Yes, the COVID-19 situation in the city of St. Louis and across the nation has been very fluid. Right now in the city of St. Louis, we are seeing an uptick in the number of cases associated with COVID-19. And that is in part due to a lot of additional social gatherings and individuals not properly socially distancing themselves and not wearing masks. However, we're not seeing a resurgence like other parts of the country are seeing, such as Florida, Arizona, and Texas. We have done a good job of maintaining and slowing the spread of COVID-19 in the St. Louis area. However, there's still a lot of work to be done. We understand that the COVID-19 pandemic is a very a serious issue that's impacting lives across the world, but it's really important for individuals to know that although lives have been lost due to COVID-19, it is a preventable disease, meaning that there are mechanisms and measures that individuals can take to prevent or at least reduce their risk for being infected with COVID-19. COVID-19, similar to other respiratory illnesses, is spread from person to person. In particular, it's spread by respiratory droplets. So as we talk, sing, cough, or sneeze, these respiratory droplets, they spray out into the air. And these respiratory droplets can fall on another individual's mouth, nose, or even be inhaled. And also it can fall on commonly touched surfaces. And so it's really important for individuals to understand this, because this is how we prevent. Knowing this gives us the tools we need to prevent the spread of COVID-19. For example, if I'm talking to you now and there isn't a barrier in place, there's nothing to catch the respiratory droplets. The role of the face covering or face mask is to catch those respiratory droplets to not only prevent others from being exposed to infected respiratory droplets, that in the event that I'm infected or you're infected, but it also helps protect us in the event that someone around us is infected. It prevents us, or at least reduces the potential for us being exposed to their infected respiratory droplets. However, it's important to know that the face mask only works if it's worn appropriately. And so when you're wearing it, it should cover the bridge of the nose as well as the mouth. If it's not covering the bridge of the nose or the opening of the mouth, it's not as effective. And so it's really important to wear this properly in order to reduce your chances from being exposed to COVID-19. We protect ourselves by implementing simple measures. One of those measures is by wearing a face covering. As I mentioned before, so wearing a face covering helps reduces your chance for being exposed to infected respiratory droplets. It also reduces the chance that others around you may be exposed to infected respiratory droplets in the event that you are the one that's ill. Other things that we should really do, washing our hands regularly, particularly with soap and water. That's the most effective way. Wash your hands with soap and water, and then when soap and water are not available, it's really important to use hand sanitizer to sanitize your hands. Another important step is to stay home if you're ill. If you have symptoms of respiratory illness, whether you have a cough, fever, etc., it's really important to stay home because at this point we cannot differentiate COVID-19 from other respiratory illnesses just based on the symptoms. So to protect yourself, your family, as well as your colleagues at work, it's really important that you stay home if you're feeling ill. The other important piece is social distancing. Social distancing is really important as well because the closer individuals are to one another, particularly if they're within 6 feet, there's an increased risk for spreading COVID-19, especially if you aren't wearing a face mask or face covering. And so one of the things that we can do is when we're out in public, we can make sure that you're staying at least 6 feet away from others that aren't within your household. Again, that helps protect you and your family from being exposed to COVID-19 for others that may be around you. Ventilation plays an important part in slowing the spread of COVID-19 as well. So when we look at the types of exposures that occur, a lot of times those exposures are in indoor setting where the ventilation isn't as great as it would be if you're outdoors. And so especially when you're indoors inside public spaces, it's important that you stay 6 feet away, at least 6 feet away from other individuals, and wear your face covering. And so again, ventilation, or at least the movement of air, is really important to slowing the spread of COVID-19, and that's oftentimes difficult to control in indoor settings. So when it's safe to do so, you can open the windows, open doors to increase ventilation in an indoor space, or if you're able to host an event outdoors, that's another great way to help reduce the potential of COVID-19 spreading at a particular event. At this time, as we see the situation evolving in the city of St. Louis, and we also see what's happening in other parts of the United States and the world, it's really important to know that we all have a responsibility to slow the spread of COVID-19 in our area. The simple measures that we've talked about before, so wearing a face covering properly, physically distancing yourselves from others when you're out in public spaces, particularly individuals that do not live inside your home, as well as washing your hands regularly, wiping down frequently touched surfaces regularly. Those steps, although they can seem very simple, are very important to slowing the spread of COVID-19. Understanding how the disease is transmitted gives us the key to actually slowing the spread. We all know it's spread from person to person, but it's up to us to actually implement those simple measures that have proven to be effective in slowing the spread of COVID-19.